Welcome to the Omni Dental Podcast. Today we're diving deep into something, well, fundamental but often overlooked, the dental arch. We tend to focus on individual teeth, right? Shiny white teeth. But the arch, that's the underlying architecture. It's the blueprint that makes your whole smile, well, work. Think of this deep dive as your guide to understanding the real mechanics behind a healthy, lasting smile.
That's a great way to put it. Our goal today is to really unpack the structure and the function of these arches based on the source materials we reviewed. We'll look at how they work, how to keep them healthy, what happens when things go wrong. And we'll also touch on a practice that really focuses on this comprehensive view, Omni Dental and Medspa in Arlington Heights, Illinois.
Okay.
You probably know what your teeth do, but do you really understand what that curve, that arch shape does for you? That's what we're exploring.
Exactly. That's the big question, isn't it? I mean, we know they hold teeth in place. Seems obvious. But structurally, mechanically, what else are these arches really doing for us, beyond just being a holder?
Well, holder is really underselling it. The arch is the framework. So structurally speaking, a dental arch is that curved setup formed by your upper and lower jaws. The upper arch, that's the maxilla, typically holds 16 teeth. And the lower arch, the mandible, usually houses 14 teeth. It's not just about holding them, it's about creating balance.
Okay, hold on. 16 teeth up top, 14 below. Doesn't that difference, inherently create some kind of imbalance? How does the mouth compensate for two fewer teeth on the bottom to keep things stable?
That's a really sharp observation. But the system is quite brilliantly engineered. The lower arch compensates mainly through the specific size and shape of the teeth, and also a natural curvature known as the curve of Spee. Plus, the whole design ensures the upper arch slightly overlaps the lower one. This means pretty much every tooth bites against one or sometimes two opposing teeth. That setup distributes the really immense force of chewing evenly across the entire arch.
Okay, so it's a precision system.
Absolutely. And that precision directly leads to the four key functions that make the arch so vital for overall health. First off, efficient chewing. For your body to digest food properly, it needs to be broken down effectively. That requires the teeth meeting just right. Second, it's crucial for clear speech. Think about it. The position of your teeth affects how air flows, how your tongue hits your palate. It's fundamental for pronunciation.
Right, I can definitely see the speech connection. What about the other roles, maybe the ones people don't think about as much, like facial support?
Yes, facial support is huge, and it's more than just looking good. The arches literally maintain the vertical height and structure of your lower face. When you lose teeth, especially multiple teeth, that underlying bone, the alveolar bone, starts to shrink because it's not being stimulated by chewing forces. That bone loss is precisely what leads to that sunken or sagging look around the mouth as people age or after tooth loss. The arch provides that essential scaffolding.
Wow, okay. Scaffolding, I like that analogy.
And the fourth key role is jaw stability. A well-aligned arch means a balanced bite. This minimizes strain on your jaw joints, the TMJ and the muscles around them, if your bite is even slightly off-kilter. That misalignment can snowball into chronic problems like headaches, neck pain, even that clicking or popping in the jaw.
That really shifts the perspective. It's not just cosmetic, it's digestion, pain, facial structure. So if these arches are so precisely designed, what are the main things that can mess them up? What throws the system off? Which brings us neatly to what happens when things go wrong. If that foundation, the arch, has problems, it sounds like the whole system can suffer. What do the sources say are the most common culprits?
Yeah, the research points to three main issues that really compromise arch health and function. First up is misalignment. Crooked teeth, overcrowded teeth. They disrupt that crucial symmetry. When the bite isn't even, some teeth end up taking way more pressure than they should during chewing. Instead of forces being spread out, you get focused stress points leading to faster wear and tear, chipping, that kind of thing. Attrition is the technical term.
Okay, so uneven wear. Makes sense.
Second, and this one's really critical, is tooth loss. Losing even one tooth directly impacts the stability of the entire arch. Think of it like removing a brick from an archway. The neighboring teeth lose support and can start to drift or tilt into that gap. This shifting destabilizes the whole curve, messing up the bite across the entire jaw.
So it's not just a gap, it's like a structural weak point that spreads.
Precisely. And the third major issue is the familiar one, decay and disease. Poor oral hygiene that leads to cavities, or, importantly, gum disease, periodontal disease, weakens everything. Gum disease causes gums to recede and, crucially, destroys the bone that supports the teeth. When that foundation weakens, teeth become loose, and the arch just can't function properly under normal biting forces.
We all know people, maybe yourselves included, who put off going to the dentist. But hearing this about structural integrity, when does a little issue become something you absolutely need to address urgently?
Honestly, the sources are clear. Don't wait. If you start having trouble chewing certain foods, if you hear clicking or popping in your jaw, or maybe you get unexplained headaches, neck aches, or you just notice your bite feels different, that's the time to see a professional. Early intervention is key. Catching misalignment or bone loss early can prevent small problems from turning into really major, painful, and frankly, much more expensive reconstruction down the line.
Okay, prevention is the name of the game then. Let's pivot to that. What are the practical steps we can all take to keep these architectural marvels in good shape?
Right, the preventative roadmap. It starts with the basics, doesn't it? First, regular dental checkups. That means seeing your dentist at least twice a year. They're checking alignment, looking for early signs of trouble. Second, consistent, proper oral hygiene. Brushing twice a day, flossing daily, that's your frontline defense against the decay and gum disease that undermine the arch. Absolutely. And don't forget protective measures. This is important. If you play contact sports, a mouthguard is a must. Or, if you know or suspect you grind your teeth at night, that's called bruxism, a custom night guard is essential. These devices act like shock absorbers, protecting your teeth from chips and excessive wear, and reducing strain on your jaw joints and the arch structure itself.
Simple but effective. Now, what if things have already gone structural? Say, teeth are missing or the alignment is seriously off. What kind of professional help is available then?
When the arch structure is already compromised, we move into restorative and corrective treatments. For alignment issues, orthodontic care is the standard. That could be traditional braces or increasingly popular clear aligners like Invisalign. The goal is to systematically move teeth back into their ideal positions to restore that functional symmetry of the arch.
And what about replacing missing teeth to restore the structure?
And that's where restorative solutions come in, and they can be quite advanced. We're talking things like full-arch dental implants, or a system you might hear about called all-on-4.
All on four. That sounds pretty specific. Can you break that down a bit? Why is it structurally beneficial?
Yeah, the all-on-4 technique is really quite remarkable for its efficiency in full arch restoration. Essentially, it allows a dentist to support an entire arch of fixed permanent replacement teeth using just 4 strategically angled dental implants. These implants are placed in a way that maximizes contact with the existing jawbone, often even in cases where there's been some bone loss. This means patients can sometimes avoid lengthy bone grafting procedures and get a stable, functional set of teeth much faster. It restores the entire biting plane and the underlying support.
Okay, but what if the bone loss is too significant even for that?
Good question. That's when bone grafting becomes necessary. If the jawbone has significantly resorbed or shrunk due to teeth being missing for a long time, you have to rebuild that foundation first. Bone grafting involves adding special bone material, either synthetic or natural, to the jaw. This rebuilds the bone volume and density, creating a solid base needed to securely place dental implants for long-term success. It's all about restoring that structural foundation.
It really highlights the level of specialized care needed to fix these problems properly and ensure things work well long term. Okay, so we've covered the architecture, the potential problems, and the solutions. Our source material also introduced us to a practice that specializes in this comprehensive approach. Omni Dental and Medspa. Let's talk a bit about them.
Right. Omni Dental and Medspa is led by Dr. Bilas Poles, a DDS with over 10 years of experience. The sources note his expertise particularly in complex cases, including dental injuries and emergencies, which often involve arch issues. Their whole philosophy seems very patient-focused, personalized plans, using advanced tech for better accuracy, making appointments comfortable.
And for anyone listening in the area, they're located at 305 E Rand Road in Arlington Heights, Illinois.
Exactly. And they serve a wide area around there, places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, Oak Grove Village, providing access to this kind of advanced care for many communities.
What really jumped out at me from the sources was the Medspa part. It's Omni Dental and Medspa. It suggests they understand that link between oral structure and, well, how your face looks and feels. They offer general dentistry, root canals, smile makeovers, but also aesthetic services.
Yes, and that integration is interesting. They offer services like injectables, Botox, and fillers and skin treatments, even things like permanent makeup and body sculpting. And there's a direct link back to arch function sometimes. For instance, Botox isn't just cosmetic. It's increasingly used therapeutically to treat the severe muscle pain and tension from TMJ disorders, which, as we discussed, are often caused or worsened by a misaligned bite or arch problems. So they can treat the root cause structurally and also manage the muscular symptoms aesthetically or therapeutically.
That makes sense. A holistic approach, really, focusing on the whole picture function, structure, aesthetics, comfort. It seems central to how they operate. All right, let's wrap this up. To quickly review the key takeaways from our deep dive today. Your dental arches are far more than just tooth holders. They are critical architectural pieces for chewing efficiently, speaking clearly, and even maintaining the shape of your face. They're the foundation, plain and simple. And like any foundation, they need regular checks, good maintenance, and sometimes expert repair when things go wrong structurally.
And maybe a final thought to leave with our listeners. If we really grasp that these arches provide essential, deep support for our facial structure, influencing everything from how we chew to preventing headaches or facial sagging, how does optimizing that foundation, maybe through the kind of comprehensive integrated care we talked about, like at Omni Dental and Medspa, how does that impact not just basic function, but our overall sense of well-being, our confidence, maybe even our long-term health outlook?
That's a powerful question to ponder. How deep does the connection go? We hope this deep dive gave you some valuable new perspectives on the architecture of your own smile. Thanks so much for joining us today. We'll catch you on the next deep dive.